Hello, my name is Dr. Richard Conlon, and the following presentation will introduce self-pap smear, which is an at-home cervical cancer screening technique which can be used on a personal basis in the comfort of your own home. The large numbers of women who die from cervical cancer on a yearly basis will significantly be impacted with the use of this product. It can also screen for human papillomavirus, as well as early cervical changes which may in time lead to cervical cancer.
American Medical Review is a national platform where science and art meet, where improving and preserving health and wellness take center stage, where the spotlight seeks out and shines on the healers and innovators. These editorial profiles, presented on public television, single out advancements in medical treatments, procedures, and services. R&G Medical and Development Corporation was handpicked as a featured guest because of its commitment to promoting progress in the field of health and medicine.
Hello, I'm Morley Safer. Welcome to American Medical Review. Preventive medicine and therapies, state-of-the-art medical devices, wonder drugs, all weapons in the warfare being waged on the front line of American healthcare. And researchers are continuously searching for new ways to arm the medical arsenal. Here's one of their latest finds.
Across the world, 500,000 women are diagnosed with cervical cancer each year. 275,000 will die from it. It's a silent killer that often goes unnoticed until it's too late. With regular checkups and early detection, it's believed that the majority of these deaths could be prevented.
The annual pap smears are probably the single most important component that have reduced the invasive cervical cancer disease. Unfortunately, women haven't gone for regular examinations as they should due to time constraints, access to care, or psychological or philosophical differences. Women used to come in for regular examinations. Sometimes we would bring them in for other reasons, such as pregnancy testing or because they had a discharge or a problem. Many of these are treated over the counter now with creams and suppositories and over-the-counter pregnancy tests that don't allow us to capture these patients and bring them back for their regular care.
Although regular exams are still recommended, the medical industry has been making great strides in creating a variety of over-the-counter pre-screening tests. Because cervical cancer is one of the most successfully treated cancers if diagnosed early, it was the target of one of the first self-test kits to be made available to women.
It is unacceptable the large numbers of women who die from cervical cancer on a worldwide basis due to lack of screening. The present technologies and techniques are now available where we can easily screen large numbers of women and prevent this deadly disease by finding early diagnosis and simple treatments for these early lesions. This has prompted our development towards a personal pap screening device.
The self-pap is a simple-to-use device that allows a woman to test in privacy at a time most convenient to her, increasing her chances of early detection and subsequent treatment.
The introducer, which is placed in the tubular speculum, which aids in a comfortable entrance into the vaginal vault, is the initial step. Once the tubular speculum is in place, the introducer is then removed, and the brush and brush handle are then introduced into the tubular speculum. As the canal is distended in a circular motion, the cervix, whether it be anterior or posteriorly oriented, is centered within the tubular speculum, allowing the brush head to approach the cervix and sample the cervix adequately. After 10 rotations, the brush handle is then removed, the tubular speculum is removed, and then the brush is then placed in the transport media. This is sealed and sent to the lab for further evaluation.
The first clinical trials of the self-test showed that of the 150 samples collected from participating women, all test results were accurate.
The self-test makes it available for us to be able to see the cells, see all the cells clearly, and be able to find those cancer cells that used to be obscured and can be obscured by infection, blood, or mucus. On the conventional smear, this does happen. On the self-test in the liquid preparation, we see the cell itself, and the abnormal cells are clearly identifiable to us when we look through the microscope. The new techniques are not always available in the other countries, but the brush can still be used with the liquid and also on the slide. This test allows us to be able to get to women in remote areas or for economic reasons who cannot have a pap smear done or do not have one done, and we can screen for abnormal cells and she can be treated before it's too late.
With more accessible diagnostic tools, the medical field is better able to bridge cultures and economic frontiers, bringing people who are often neglected new hope of disease prevention.
The world of medicine is a challenging, ever-changing place, and each one of us is impacted by improvements and breakthroughs. Be sure to tune in next time for more modern miracles on American Medical Review.
Please feel free to contact us directly for any information on cervical cancer, screening programs, World Health Organizations, and regional screening programs, which we will gladly participate in. Thank you.
Wherever the art of medicine is loved, there also is love of humanity. Once again, American Medical Review extends a special thanks to the companies and organizations that have risen to meet today's health and wellness challenges. This has been a presentation of WJMK,